I wanted to ask, so now you have the online or the dry lab tools, you have the constructs. And Tom, you also mentioned that people could be using these constructs that are available at Adgene to study the interaction of any of those 215 GPCRs with other accessory proteins, other proteins. What are some of the questions you think these tools, or how are these tools going to help the community, in addition to obviously looking at ramp interactions with your GPCR, any other protein, any other ways the community can benefit from these tools, either directly or indirectly?
I'm very excited about these observations that autoimmune diseases and infectious diseases have a component in which there are some autoantibodies generated in autoimmune diseases that actually recognize GPCRs. So these would be GPCR autoantibodies that are part of the molecular pathophysiology of autoimmune diseases. And remember, endothelial cells express a large number of GPCRs, and they're exposed to these immune reactions. And it turns out that there are classic autoimmune diseases in which it's known that anti-GPCR antibodies play a role. But more recently, including in things like long COVID, there have been suggestions that auto-GPCR antibodies in disease states are part of the pathophysiology of those diseases. And really interestingly, it turns out that many of those antibodies, you'd think that if there's an antibody against a GPCR, that it's going to block the activity of that antibody. But not so fast, because some of those autoantibodies actually are activating autoantibodies. The antibody binding to the receptor causes signaling through that receptor and pathological signaling.